methodology. So it is the bottleneck of any research. So how you are doing the research. So you need to have a clear idea of how are you going to do the research. So for this question to be answered, I am giving you a simple solution. When you write a proposal only, it is almost done. You don't have to take it when you write your thesis. If you understand and make the correct answer for this 10 checklist. So that is study population, sampling and sample size, study setting, study period, study design, ethics and consent, inclusion and exclusion criteria, operational definitions and tools, study procedure, and statistical methods. If you have a clear cut idea on these 10 topics, your methodology is done. And if you do it in the proposal, you just copy paste in your full thesis or your research. First is the study population. When we are dealing with the study population, we should know about these three things. That is, the sample which we collect is called as study sample or sample population. Let's say if I am doing a research on a particular batch, 2024 batch of MBBS students, I collect information from 100 students. So that 100 students will be considered as sample or sample population. And my study population is from whom I have taken that. It will be from either, you can take it as 2024 batch, or all my college students will be the study population. The target population is after the results, I found the results, and the target population will be for all the medical students in the country or the state. So that will be my target population. So you need to understand about the study population. You need to understand about the target population. You need to understand about what is sample or studies sample. So let me put up in one more example. Suppose you are doing a study in diabetic foot. This diabetic foot patients which you got into a study is called as study sample. The patients who have come to your hospital would be the study population, because out of them only you have taken, so that will be the study population. And the target population would be any intervention from that diabetic foot. You are giving an inference to the diabetic foot population in the whole country. So that will be your target population. So we have three types of population in methodology. You should be clear about it. You have to mention all these three. Then we need to understand about your sampling methods and sample size. First is, what is meant by sampling? Sampling is nothing but the procedure by which your sample is taken from the study population. The method or the process by which the study sample or the study sample is taken from the study population is called as sampling. But you need to remember, the sampling is the method by which you take, but the inference which you make out of the study will be for the entire population. And somewhat to the target population also you make recommendations. So that is called as sampling. And the amount of sample which you take, which you require, which you are supposed to take, is called as sample size. So this sampling is again divided into two types. That is, one is random sampling, another one is non-random sampling. We have random sampling and non-random sampling. Random sampling means if you are giving equal opportunity for all the diabetic foot patients coming to your hospital to participate in the study, that is called as a random sampling. No, if you are not giving equal opportunity to all the diabetic patients, you are going to select a few diabetic patients with certain properties or certain characteristics. You are not giving equal opportunity for everybody to participate, then that is called as non-random sampling. Under probability sampling, we have four methods. Simple random sampling. When I ask what is simple random sampling, students say, if we do it simply randomly, that is called as simple random sampling. Don't do that thing. Simple random sampling is the most difficult sampling to do. It's not simple as the name indicates, but how it is done. Let us see how it is done. So that is, you need to take the list of the entire population, and you need to select your sample by random numbers. You need to include those to the study. That is called a simple random sampling. So to get the entire database is very difficult, and you need to do any random method to select the sample also. So that is why it is not simple, I said, but it is called a simple random sampling. We have systematic random sampling. Suppose we have 250 students. If we are taking based on the random generated numbers or random generated computers, then that will be called as simple random sampling. Let's say you are taking every fifth person for 50 sample, you take every fifth person 1, 5, 10, 15, then it is called as systematic random sampling. And the next one is the stratified random sampling. That is nothing but you want equal representation from boys, girls, and also from different characters like past, that is academic performance. Then you divide it into various strata, and from that strata you again do a simple random sampling or a systematic random sampling. That kind of stratification, and after stratification you do a random sampling, that is called as stratified random sampling. And we have cluster sampling, that is you take few clusters. Let's say in 250 students, if you are taking one particular unit from surgery, one particular unit from medicine, one particular unit OG, like that, if you club students from clusters, that is called as cluster sampling. In community medicine, we use villages, and with a minimum of 30 clusters in each sampling. So these are the types of the probability sampling. And we have non-probability sampling, that is again divided into convenience sampling, judgmental or purposive sampling, snowball sampling, and quota sampling. The most commonly used non-random sampling is this convenience sampling only. That is, you take up the study participant on your convenience. And there are some judgmental or purposive sampling, which means you take a particular characteristic of diabetic foot in order to achieve a particular result. That is called a judgmental or purposive results. And this snowball sampling is a sampling where you get the first few patients, and those first few patients will give you whom to contact the next person. So that next person will be your next sample. Most of the diseases with more stigma, like HIV, sexually transmitted diseases, and leprosy, these kind of stigmatic diseases, we have to follow this snowball sampling. If you get one leprosy patient or one HIV patient, they will give 2 3 HIV patients contact. You can contact them and get the data from them. And you have quota sampling. As I told, you have diabetic foot, you have different grades of diabetic foot. You need to include different grades for studying different results and particular characteristics. If you are informing, then that is called as quota sampling. That is the non probability sampling methods. So with this, we are clear with the sampling methods. And don't worry what is the sampling method which you are using. Always get a help from a person who is good in research, especially in community medicine departments. You can get for sample size. What is the prerequisites is sample size can be easily calculated using the formulas which are simple. Many colleges under UG exercises, statistical exercise, they have this sample size calculation. You can use those formulas, and there are softwares and there are websites. But don't worry about how we are going to calculate the sample size. One basic thing which you should know before calculating the sample size is there is no fixed sample size for your objective. After deciding your objective, based on your wish only, this is actually the justification of your sample size. Suppose, let's say you want to do the study on 50, or you can do the study only on 50 patients, means then if you do it with 50 patients, how much is your precision? That's what we are going to do with this sample size calculation. So if you tell your desired sample size, then automatically they will use any of these methods like formula, software, or websites. But the technique for that, to use that, you need your clear objective. So objective should be clear. This objective is one thing which starts from your title and ends with your conclusion. Even with annexures also it will continue. So you should be always clear about your objective and in context with your objective also, wherever whatever you do. The exact matching study if you take, and if you're clear about your objective, if you ask for your help, any statistician or a person expert in community medicine can help you out with the formula and software and websites. That's again one full session we need to go on it. So right now we are cutting short. So sample size is one parameter in the methodology. Now the third thing is the study setting. You need to clearly mention about the characteristics of the patient, where, what is the geographical location, what is the hospital they are attending, what is the department, whether inpatients or outpatients, based on what characteristics they have been recruited. All these things has to be mentioned in the study setting. And the next most important thing is the study period. Many of the students will make it as a gang chart. So that is how they have spent the entire time period. Nowadays it's not followed. During our days it's a mandate that after joining your course, within 6 months you need to submit your proposal. 6 months before your exams you need to submit your thesis. So this 2 years interval will be your study period. That's fixed for us. But nowadays, because of so many changes, this period also is getting concerned. But you need to understand how you have done this research. So the entire 2 years, how you have spent for literature review and research methodology designing, how much you have spent, and the methodology workshop you have attended and gained the knowledge, finalization of the research protocol. When did you started the data collection? This is what most important. Many people think that study period is the data collection only. To under study period, you need to mention this data collection also. Some people will do pilot study. Pilot study we do for the standardization of the tool. When was the pilot study done, and what was the modification done? And after that, your data collection continued. How long and how much time it took for write up? How much time it took for the submission, printing? That also you need to make entry into the study period. Now we move on to the study design. This is one algorithm which is taken from Leon Goddess. So you need to ask yourself whether you are going to have any intervention or not. If yes, that is an experimental study. If no, it is an observational study. Under experimental study, you are going to ask next question: are you going to give that intervention through random allocation? If yes, it is a randomized control trial. If no, it is a non-randomized control trial. If you don't assign any intervention, that is an observational study. If you have a comparison group, that is an analytical study. If you don't have a comparison group, that is a descriptive study. All your ecological studies, case series comes under this descriptive study. If you have a comparison group, that is an analytical study. And then you need to ask yourself the question, how are we going to measure the direction of the exposure? You are going to measure the direction, both the exposure and outcome at the same time. That is a cross-sectional study. If you start from exposure, go to the outcome, that is a cohort study. If you start from outcome and go to the exposure, that is called as case control study. This is the algorithm for the study design. The next important thing is about the ethics and consent. So we need to understand about the four cardinal principles of ethics, that is autonomy, beneficence and non-maleficence and justice. Autonomy is the right of the patient, the right of the participant. Beneficence is something good for the patient. Non-maleficence is do no harm, that is not harming the patient. And justice is what is right for the situation. If it is what is the right of the individual, that is the autonomy. Right for the situation and right for the patient, that is called as justice. As a part of ethics, we need to understand about the consent and the patient information sheet. The basic difference between consent and patient information sheet is consent is for the researcher and patient information sheet is for the patient. Even though most of the content will be the same in consent and patient information sheet, you need to remember you should take the consent and the patient information the sheet should be handed to the patient. So what and all you should have here is you should have the main purpose of the study should be mentioned. Then procedures in the data collection should be mentioned. Potential risk, benefits, all should be mentioned, and you should mention about the confidentiality of the participant and the voluntary participation, and withdrawal is possible at any time. This you can mention, and you need to get the signature of the participant and researcher. And you need to give the same information, your contact detail, to the patient in patient information sheet. So that is about the consent and patient information sheet. The next important criteria is the inclusion and exclusion criteria. Inclusion criteria means from whom you can extract the information about your study objective. That is called as exclusion criteria. The person who induce bias can be included in the exclusion criteria. And always remember, these two are not mutually exclusive. If you are mentioning all women in attending OG department, you cannot mention the exclusion criteria, all men will be excluded. That cannot be done. So it is not mutually exclusive. So when you include somebody, from them, the potential bias, people who induce bias, or to an extent, if it is confounders, you need to remove that from the exclusion criteria. So that is the inclusion and exclusion criteria or the eligibility criteria. Then we move on to the operational definitions. Based on your study, you define paleo diet, you define diabetes mellitus, you need to have an operational definition. This is very critical. Why? Because when you compare it with other studies, and some other studies in future want to compare your study, then you need to have a proper definition. Suppose, let's say you are following definition of diabetes mellitus as, let's say, urine sugar was your diagnosis, then the widely accepted fasting and postprandial or your HbA1c cannot be studies which done on these domains cannot be compared. So if you define your diabetes mellitus based on urine sugar, so same way you need to mention your operational definitions and study tools. There are different study designs available. We have primary research and secondary research. Most of the times your PG time, the mandatory research are your primary research only. It can be either survey or polls, interviews, focus groups, and observations. So interviews are the data collection which you do from the patient. That is the primary research. How are you going to do the research? What is your questionnaire consisting of? Your questionnaire should be attached in the annexure. So that also you need to remember. And the last most important part is the hook to the next session. That is the statistical methods. So you need to have an idea about your questionnaire and idea about how that questionnaire yield variables and how that variables are going to get analyzed. So all these things you need to understand before doing the study. That is an important thing in the methodology. And the last but not the least is the statistical method. Just to see this picture, we will see that in detail. I am going to end up this methodology session with one important thing, that is called as, to ensure the quality of the research, we have the checklist based approach. That is, there are different checklists available based on the type of the study. If I say consult guidelines, many of you will remember it is a checklist for standards of randomized controlled trial. That is, many people will know. Some community medicine PGs can know this strobe guidelines are used to assess the standards of observational studies. So like that, we have different checklist based approach. There are certain set of parameters. If that parameters are fulfilled in the study, then that study is of a good quality. This is a checklist based approach. And equatornetwork.org is a site where you can access all these guidelines freely downloadable. You can see this site. So randomized control trial, consult, observational studies, strobe, systematic reviews, prisma, case reports, care guidelines. We have nice guidelines also. If you go to the extension or you click on this case reports, you will get the nice guidelines also. Qualitative research, we have core guidelines, SRQR guidelines, diagnostic or prognostic studies, START guidelines, and tripod guidelines. START guidelines, I'm going to show it now. Right now we have economic evaluations, cheers guidelines, animal studies, arrive guidelines, study protocols, spirit guidelines, clinical practice guidelines, agree and write. All are available freely downloadable in equatornetwork.org. One important thing which you want out of my methodology session, I would recommend this point, that is checklist based approach. And you are not clear about how to arrive at this guidelines, which guidelines I'm supposed to do. If you are not clear about your study design, I want to know what guidelines to apply on my research. Here is the algorithm to find out which guidelines you should use. So this is the START guidelines, which is used for diagnostic studies. All the microbiology PGs, biochemistry PGs, pathology PGs, radiology PGs, or any PGs doing a study on diagnosis, they have to apply this START guidelines and see whether most of the parameters are fulfilled or not. So this checklist will ensure you that research what you are done is out of good quality. So this is a START guidelines which has a 30 item based checklist, and consult guidelines is a 35 item checklist. So that also you should remember. To sum up before ending my session on methodology, we have these 10 parameters apart from this checklist based approach which you need to write. You should be clear about your study population, study setting, sampling and sample size, study period, design, ethics, consent, eligibility criteria, operational definition, study tools, study procedures, statistical methods. I end my methodology presentation